Have you ever sat down in a doctor's office, looked into their eyes, and quietly wondered, what are they really thinking about me right now? Don't worry, you're not alone. It's a question many people have, but rarely say out loud. And here's the truth. Behind that polite smile, behind the professional white coat, there can sometimes be hidden thoughts, silent assumptions about you simply because you're older. Now, these thoughts aren't always cruel or intentional, but they can have a real effect on the care you receive. That's why today, we're going to uncover 5 of the big unspoken truths about how doctors often see seniors. Some of these might make you nod in recognition, others might sting a little. But by the end, my hope is that you'll feel more confident, more ready to walk into your next appointment, and make sure you're seen, heard, and respected for the person you are, not just the number on your birth certificate. So grab a cup of tea, settle in, and let's dive into the first big one. Picture this. You walk into your doctor's office and say, "Doctor, I've been feeling unusually tired lately. I've been forgetting things. My joints ache more than usual." And the doctor, instead of leaning forward and digging deeper, simply shrugs and says, "Well, that's just what happens at your age." Have you ever heard something like that? Maybe not those exact words, but the message is the same. Don't worry, it's just age. Now here's the problem with that mindset. It can close the door to real answers. Yes, aging brings changes, of course. Our bodies are like cars that have seen many road trips, a little more mileage, a few scratches on the paint, maybe a part that squeaks. But if your car suddenly starts making a new noise, would you accept the mechanic saying, "Hey, it's just old"? Of course not. You'd want them to pop the hood, check the engine, and figure out what's really happening. The same should be true with your body. That shortness of breath you're feeling, sure, it could be slowing down, but it could also be an early sign of heart disease, which can be treated if caught in time. That forgetfulness you laugh off as senior moments. It might be linked to a thyroid imbalance or even a medication side effect. Both are reversible, and science backs this up. A study published in the Journal of the American Geriatric Society found that up to 30% of symptoms dismissed as aging were actually caused by treatable conditions, things like vitamin deficiencies, depression, even early cancers. 30%. That means a third of people walked away with no help when real solutions existed. I once knew a man named Robert, 82 years old, full of life, who started feeling crushing fatigue. His doctor told him, "Robert, you're just getting older. Take it easy." But Robert trusted his instincts. Months later, after pushing for more tests, they discovered a heart valve problem. Surgery fixed it, and suddenly, his energy returned like someone had switched the lights back on. Imagine if he had accepted that first answer, he'd still be sitting in his chair, exhausted and defeated. So here's the takeaway. Age is not an explanation. If your body is sending you signals, don't settle for just old age. Ask questions. Push for tests. Your health deserves the same detective work at 80 as it did at 40. Here's another unspoken thought. Some doctors carry older patients won't stick to complicated treatment plans. Now, does that sound familiar? Have you ever been handed an oversimplified prescription or brushed past quickly because the doctor assumed you'd forget the details? Let's break this down. Some physicians worry about memory, about juggling multiple medications, about hearing instructions clearly. Their inner voice might whisper, "I'll just keep it simple," because they probably won't follow through. On the surface, that might sound considerate. But here's the danger. By underestimating you, they might hold back life-changing options. Think about it like this. Imagine going to a restaurant, opening the menu, and the waiter only giving you one choice because he assumes you'll be confused by too many options. You'd be furious, right? You'd say, "No, let me decide what I want to eat." Well, that's what happens when doctors simplify your care without telling you everything that's possible. Let me tell you about Carol. She was 79 when diagnosed with a heart condition. Her first cardiologist gave her the bare minimum, a simple pill, some vague advice. Why? Because he assumed she wouldn't want to deal with anything complicated. But Carol wanted to fight. She switched doctors, and her new physician sat down with her, walked her through every treatment from new drug combinations to lifestyle changes to exercise, and guess what? Carol followed every step. Today her heart is stable, and she lives with energy that surprises everyone around her. And science agrees. Research in the Lancet Healthy Longevity shows that adherence to treatment has much more to do with clear instructions and patient motivation than with age. In other words, If the information is given clearly and the patient feels supported, seniors follow plans just as well as younger people. So the lesson is simple: don't let anyone assume you're not capable. Bring a notebook, ask for written instructions. Show your doctor you're listening, engaged, and ready. That simple act can shift their entire approach and open doors to treatments you might otherwise never hear about. This one might sting a little, but it's real. Sometimes when doctors have limited time or resources, they lean toward prioritizing younger patients. The hidden thought is, this person has more years ahead, so my effort will have a bigger payoff. Let's imagine two patients in a busy emergency room. One is 35, one is 75. Both have knee pain. The doctor might rush the younger one into testing, thinking about decades of future activity. The older patient, sometimes told, "It's probably arthritis, take it easy." But is that fair? No. Because quality of life matters at every age. Think of Richard, 82, who loved walking every morning. His knees became unbearable, and his first doctor said, "Knee replacement, too risky for you." But Richard didn't give up. He found another surgeon who looked at his health, not just his age. Richard had the surgery, recovered well, and got his morning walks back. His smile said it all. Life wasn't about years left, it was about joy regained. This isn't just anecdote. A review in BMJ Open highlighted how older adults are less frequently offered surgeries, even when studies show they can benefit equally, if not more, compared to younger groups. The problem isn't biology, it's bias. So what can you do? Speak up. Ask, "If I were 40, what would you recommend?" That one question puts the bias on the table and makes the doctor stop and think. And if the answer still feels dismissive, don't be afraid to seek another opinion, because your future, whether it's 10 years or 30, deserves the same care and investment. Here's a subtle one. Some doctors unconsciously assume that by your 70s or 80s, your only goals are stay comfortable, take it easy. They don't picture you chasing big dreams, but tell me, do you stop having goals just because of age? Of course not. Think of Ellen, 81, who wanted nothing more than to fly overseas to see her granddaughter. Her doctor brushed it off, focus on staying comfortable at home. But Ellen refused. She switched doctors, got a new care plan, meds adjusted, exercise tailored, and 6 months later, she was hugging her granddaughter abroad. Can you imagine the joy on her face? That's the power of seeing patients as whole people with dreams, not just numbers. Your doctor should ask, "What do you want out of this treatment? What matters to you most?" Sadly, many don't. They assume your bucket list has already been checked off. But the truth is, science supports goal-driven care. Studies in health psychology show that patients with clear personal goals are more motivated, more engaged, and recover faster, even from serious illness. In other words, dreams aren't optional extras, they're fuel for healing. So next time you're at the doctor's, share your goals. Tell them, "I want to travel, I want to garden, I want to dance again." When your care plan is built around your life, not just your comfort, the results can be extraordinary. Let's be honest, doctors are trained to look at lab numbers, blood pressure readings, x-rays, but what about the heart that breaks after losing a spouse? What about the loneliness of living alone? Too often, the emotional side of aging is brushed aside. Take Leonard, married 54 years, who lost his wife. His health declined rapidly, not just because of medical problems, but because of grief. Every doctor visit focused on medications, not his sorrow. Only when he found counseling did his energy and health start to recover. That's the hidden truth. Emotions are medicine too. Research confirms it. The American Psychological Association notes that depression in older adults often shows up as physical symptoms: poor sleep, low appetite, fatigue. If doctors ignore the emotional layer, they miss half the story. Think of it like a tree. If the roots are dry and starved, the leaves will wilt no matter how much water you pour on top. Your emotions are those roots. Nourish them and the whole tree flourishes. So don't hold back. If you feel lonely, sad, or anxious, tell your doctor. It's not complaining, it's giving them the full picture. And if they brush it aside, that's your signal to insist or find someone who listens. Because health isn't just about living longer, it's about living lighter, freer, with a heart that feels whole. Remember how we talked about doctors brushing symptoms off as just aging? Here's how you counter it. You become the detective of your own health. If something changes in your body, whether it's a new pain, sudden fatigue, or memory shifts, ask for evidence, not reassurance. Instead of letting the conversation end with, "That's normal for your age," you can respond, "Doctor, what else could be causing this?" Can we test for those possibilities? It's a small shift, but it reframes you from a passive patient to an active investigator. Think of your health like a mystery novel. Every symptom is a clue, and you're the main detective, with your doctor as your partner. Would Sherlock Holmes ever shrug and say, it's probably nothing? No, he'd chase down every lead until the truth was revealed. That's the mindset to bring into the exam room. And here's the science behind it. According to the National Institute on Aging, early detection is one of the strongest predictors of successful treatment in conditions like heart disease, cancer, and cognitive decline. Translation: asking for more tests isn't nagging, it's life-saving. So write this phrase on a sticky note if you have to. Please rule out other causes before calling it age. That one sentence can change the outcome of your care dramatically. We also talked about the myth that seniors can't follow treatment plans. How do you bust that myth? You show up prepared and engaged. Bring a notebook. Bring your glasses. Bring your reading list if you have one. When the doctor sees you writing notes, asking questions, and confirming instructions, their assumptions melt away. Here's a trick I often recommend: repeat back what the doctor says in your own words. So you're saying I should take this pill in the morning and the other at night, correct? That small act shows two things. You're listening and you care about accuracy. Doctors love that, because it makes their job easier. And if you ever feel like you're drowning in instructions, break them down into simple daily habits. For example, if you have to take 3 medications at different times, place them next to things you already do. One by your toothbrush, one by the kettle, one by your bedside. Suddenly, it's not 3 pills, it's brushing, tea, and bedtime. Easy. Research supports this. Studies in patient education and counseling show that seniors who use routines and reminders are just as adherent as younger adults. The barrier isn't age, it's organization. So next time your doctor hesitates to share a complex plan, prove them wrong by saying, I like details. Give me everything so I can decide. It's like telling the waiter, yes, bring me the full menu, I'll choose what's best for me. This one's tricky because age bias often hides under the surface. So how do you bring it out into the light? With a powerful question: if I were 40, what would you recommend? This question works like magic. It forces the doctor to step out of their bias and think in purely medical terms. And more often than not, you'll discover options that weren't even mentioned before. Here's a real-life story. A woman named Margaret, 76, was told her chest pain was probably indigestion. She asked her doctor that very question. If I were 40, would you still say indigestion? The doctor paused, ordered tests, and discovered blocked arteries. Margaret ended up having a successful procedure that gave her years of renewed life. So the key is not confrontation, but curiosity. You're not accusing. You're simply asking, what would you do differently if I were younger? It opens a window. And if you sense your concerns are still being sidelined, don't be afraid of a second opinion. You'd get another estimate for your roof or your car, wouldn't you? Why not for your health, which is far more valuable? Doctors sometimes assume seniors only care about comfort, so it's up to you to put your goals front and center. Before your appointment, write down what matters most to you. I want to dance again, I want to travel, I want to keep gardening, then say it out loud in the room. Why? Because once your doctor knows your why, they can design a treatment that fits your life instead of shrinking it. Imagine 2 patients with knee pain. One just wants to sit comfortably at home, the other wants to hike in the mountains. The treatment might look very different, but the doctor won't know unless you tell them. Think of Ellen, the 81-year-old who wanted to fly overseas. By voicing her dream, she changed the whole trajectory of her care. That's the lesson. Your doctor doesn't just need to know your symptoms, they need to know your story. And science confirms it. A 2018 study in JAMA Internal Medicine showed that patients whose goals were explicitly discussed with doctors reported higher satisfaction and better outcomes, even when treatments were challenging. Your goals are medicine too, so don't hold back. Share them proudly. After all, what's the point of good health if it doesn't help you live the life you want? And finally, let's address the most overlooked piece: the emotional side of health. Doctors might not ask about your loneliness, your grief, or your fears. That doesn't mean they're not important. It means you have to bring them to the table. The truth is, emotions are like hidden passengers on the bus of health. You might think only your heart or your joints are in the driver's seat, but if sadness or anxiety is sitting in the back, they can still grab the wheel and steer everything off course. So what do? Practice honesty. When the doctor asks, "How are you doing?" Go beyond "I'm fine." Instead say, "I've been feeling lonely," or "I'm still struggling after losing my partner." These words may feel vulnerable, but they open the door to resources you may never have known existed: counseling, support groups, even medication if needed. And here's the science. The World Health Organization recognizes loneliness as a significant risk factor for early mortality, on par with smoking and obesity. That's how powerful emotions are. By naming them, you're not just talking, you're protecting your health as much as by taking a pill or going for a walk. So let's make a pact right now: next time you see your doctor, share at least one honest sentence about how you're feeling emotionally. Think of it as watering the roots of your tree, because when the roots are cared for, the whole tree thrives. As we come to the end of this conversation, I want you to pause for a moment and really let something sink in. Your health journey is not just about lab results, prescriptions, or the aches and pains you carry. It's about your story, and your story is still unfolding. Each appointment, each decision, each choice you make adds another line to the chapters of your life, and the truth, those chapters are just as meaningful now as they were decades ago. Too often, the medical world tries to measure life by numbers: blood pressure, cholesterol, years left on the clock. But you and I both know that numbers never tell the full story. They don't capture the joy of watching a grandchild smile, they don't measure the pride of planting a garden and seeing it bloom again in spring. They don't calculate the warmth of sitting at a dinner table surrounded by people you love. Those moments are health too. They are as real as any prescription you'll ever take. Now, maybe some of what I shared today struck a nerve. Maybe you've sat in an office and felt brushed aside, told that your symptoms were just aging. Maybe you've sensed your doctor holding back on treatment options, assuming you couldn't handle them. Or maybe you've carried loneliness or grief quietly, while everyone around you focused only on your blood pressure and your medications. If any of that resonates, I want you to know this: you are not imagining it, and you are not alone. But here's the empowering part: knowing these hidden truths gives you power. Power to speak up, to ask questions, to expect the kind of care that sees you not just as an age, but as a whole person with dreams, goals, and feelings. Think of it like walking into a room and switching on the light. Suddenly, what was hidden is revealed, and you can see clearly where to step next. Every time you remind a doctor that you want answers beyond just old age, you are taking back control. Every time you say, "Give me the full picture, I can handle it," you're opening the door to better care. Every time you share a goal, whether it's traveling, dancing, or simply feeling strong enough to play with your grandkids, you're reminding the medical world that life after 70, 80, or even 90 is not about shrinking, it's about living fully. And let's not forget the emotional side. So many seniors carry invisible weight: loneliness, grief, worry about the future. When you find the courage to voice those feelings, you're not just protecting your heart, you're protecting your entire body. Science is clear: emotions affect sleep, appetite, immunity, even recovery from illness. By caring for your emotional well-being, you're adding years to your life and life to your years. Now, I know it's not always easy to challenge assumptions, to ask for more, or to admit when you're struggling, but remember this: advocacy doesn't have to be loud. It doesn't have to be confrontational. Sometimes it's as simple as a question, a request, a gentle reminder that your story matters. Small words can open big doors. Think of your health like a garden. You've spent decades planting seeds, habits, memories, relationships. Some plants thrive, others wither, but the garden is still alive, still growing. Doctors are like gardeners, but you are the owner of the soil. You get to decide what's planted, what's watered, and what needs more sunshine. Without your voice, the garden may be left untended. With your voice, it can flourish beautifully, even in later seasons. So let me ask you, what do you want your next chapter to look like? Is it walking pain-free through your neighborhood? Is it traveling to see someone you love? Is it finally starting that project you've been putting off? Whatever it is, hold it close and bring it into every medical conversation, because your health is not just about surviving, it's about making those dreams possible. And here's the final thought I want you to carry: you are not a burden, you are not too old, you are not past the point of mattering. In fact, the wisdom, the resilience, the perspective you carry, those are treasures that younger generations desperately need. When you insist on proper care, when you refuse to be dismissed, you're not just helping yourself, you're paving the way for every senior who comes after you. You're showing the world that aging is not an ending, but a continuation of value, of purpose, of strength. So as you walk into your next appointment, do it with confidence, sit tall, breathe deeply, and remember your story is still being written. The doctor may hold the stethoscope, but you hold the pen, and with every question you ask, every goal you share, every emotion you voice, you're writing a chapter filled with dignity, courage, and hope. Thank you for being here, for listening, and for caring enough about yourself to want more. If this message resonated with you, consider sharing it with someone else who might need encouragement. And if you'd like to continue these conversations, subscribe and stay connected, because together, we're building a community that refuses to be overlooked, a community that knows the value of every single year and every single heartbeat. So here's my final reminder: your life matters, your health matters, and no matter what anyone says, you deserve care that honors the full, beautiful story of who you are.